Well, Mrs. Miller, I'm Dr. Moss. I'm a nephrologist and a palliative care physician. And your nephrologist who treats you at the dialysis center, Dr. Gonzalez, asked me to have a visit with you. And thank you for agreeing to do this one by telehealth. I think that's the best thing to do with everything going on with COVID-19 right now. So we're going to have a telehealth visit, if it's okay with you.
Sure.
To talk about I know you've just had a recent experience with being in the hospital, and from what Dr. Gonzalez said, you were even on a breathing machine. So it was sort of rough, and we'll talk about that admission. And he thought he really wanted to know more about what's important to you, what types of treatment you would and wouldn't want, so that he can respect your wishes going forward. So is it all right if I talk to you about those things as a telehealth visit?
Sure.
Okay. Okay. All right. Well, to start with, could you please tell me a little bit about yourself?
Okay. Dr. Moss, I'm 67 years old. In fact, I just turned 67 last week. I'm on dialysis. I've been on dialysis for the past 12 years. And what caused my renal failure is smoking. I love to smoke. I started smoking when I was 16. So now 67, that's 51 years. However, because of that, I have the bad health that I have today. Along with the smoking, I knew there was high blood pressure in the family. And I know smoking, I just recently found out that smoking can cause that. However, never followed up with doctors. They would give me medications to help prevent, to lower the blood pressure. However, I never took the medication. When you're young, you don't think it's going to happen to you. Well, it did, and it's hit me hard. So I have bad lung disease, and I have heart problems.
Yeah, let me just follow up on what you said. So you said your smoking caused your kidneys to fail. Typically, that happens as a result of hardening of the arteries and the blood flow to the kidneys. And sometimes even the high blood pressure can cause the kidneys to fail. Did they indicate to you, was it a circulation problem with your kidneys, or was it the long-term effects of the high blood pressure?
Long-term effects of the high blood pressure.
Okay. All right. And what has it been like for you in the last year?
Well, it's been tough. When I started dialysis 12 years ago, I thought, I can do this. I was living a good quality of life, going to dialysis 3 times a week, handling the diet. But last year was tough. I was in the hospital 3 times with fluid overload. The technicians and stuff, I just love them. And the nurses, however, they have not been able to help get the fluid off of me. So not only with the hospitalizations, but I feel like crap after dialysis. Okay. And I don't feel good until the day that I come back to dialysis.
Okay.
So,
right. And does your blood pressure drop on dialysis? Is that the reason?
Yeah, it sure does. In fact, it's awful. I start cramping. I get nauseated. Sometimes I'll throw up. And several times I've gone out on them. So it's been tough for me and for them.
I know we're doing this interview at home. It sounds like there's some background noise.
My husband just came and got the toy and took the dog out.
Okay.
Sorry about that.
Maybe that was your dog yapping a little bit in the back.
It was. He was playing with his toy. See, my dogs, I feed them, so they do whatever they can to stay by me.
Okay, sure, yes.
So he's trying to take care of the problem now. Sorry about that.
So you were describing the fact that your blood pressure drops on dialysis. Have you been told you have heart problems too?
Yes, and in fact, I was told at my last hospitalization that I was in heart failure, that my heart muscle is not working like it should be. And I'll be honest with you, Dr. Moss, I can tell the difference. I get short of breath a lot easier. My quality of life has totally gone down. I can't do the stuff that I used to be able to do, walk. I used to love playing with my grandkids. They're the love of my life. However, I just don't have the stamina and energy to do that. And I've seen it decrease.
Yes. So I'm curious, have they done something called a heart catheterization? Have you had bypass surgery?
They did that. It's funny, they did that 9 years ago when I had a coronary artery bypass. I've had stents put in to help in the past 9 years after the coronary bypass. However, because my arteries are so stiff due to the calcium buildup, I can't have anything else done.
I see. Okay. So right now we're sort of talking about your overall medical condition, if you will, and we've talked about your heart and your lungs and your kidneys. So what's your understanding of your major medical problem now?
That my heart's failing.
I see. And that's what the cardiologist has discussed with you?
Right. Well, several of the doctors that have come in with the hospitalizations have come in to tell me, this is what's going on. Your body, your heart, the muscle is tired from having to pump all those fluids. So even if I come in with 1 kilo, 2 kilos, my heart can't handle it.
Okay. And did he give you an idea of how serious this problem was?
He did. In fact, he had given me advice to talk to my family to see what, and to try to figure out what my quality of life, what I define quality of life as opposed.
I see. Let me ask you a question that we've asked dialysis patients in the past. Some patients tell me they want to live as long as possible, even if it entails some increased suffering and being kept alive on machines at times. And other patients tell me that quality of life is more important than quantity of life, and they would prefer to live a shorter period of time if they could avoid pain, suffering, and breathing machines. Which group would you say you're in?
Well, I'd like to live as long as I can.
I'm trying to understand what would be important to you. If you were to get short of breath and go to the emergency department, would it be all right if they put a tube in your throat, that they could pull you through the illness if you were on a breathing machine for a short while?
That I would have to say no. Not to go on a ventilator.
Okay. And what's your understanding then? If you were not to go on the ventilator, what might happen?
I'd end up dying.
Okay. All right. Can you tell me what was so bad about that experience?
Well, I kind of came to during the time that I was on the breathing machine, and I tried to take the tubing out, and they had to tie my wrist down. I don't want to be tied down like that.
I see. Okay. And many patients say that. So I'm assuming, but I want to make sure, let me check with you, that if you wouldn't want to be on a breathing machine, if your heart were to stop, you would not want us to shock your heart and try and...
That's correct. I do not resuscitate.
Okay. And have you told Dr. Gonzalez that?
Every time I go into the hospital.
Okay. All right, good. All right. So it's important that we sort of be very clear about what you want and what you don't want. I'm going to hold up a physician orders for life-sustaining treatment form, this pink form. Have you seen one of these before?
No, I have not. No, Doctor.
Okay. Well, if it's okay, let me walk you through it to be sure then that I understand what you would want. So on the form, there's level of medical intervention, and it says, and you just told me that you really wouldn't want to go to the intensive care unit and be put on a breathing machine again. That's full treatment. There's a sort of intermediate level where you're fine with going back to the hospital, getting treatment, antibiotics, cardiac monitoring, heart treatments, short of going to the intensive care unit. Or there's something called comfort measures where you don't go back to the hospital as long as you can be kept comfortable at home. Which of those are you leaning towards more now?
I would think the intermediate.
Okay. That's what I was going to guess too, but I didn't want to play that just in case I was wrong. So that would mean if you were to get short of breath again, you go back to the hospital, they do what they can. Maybe they do an emergency dialysis, pull some fluid off. Maybe they do some heart treatments. and help you with your breathing and, help you to continue to live for a longer period of time. So if it's all right, then I will do one of these forms, and it says in section A, do not attempt resuscitation. In section B, it'll say limited additional interventions. We didn't discuss this. Is your husband the one you would want to make medical treatment decisions for you if you were too sick to make them for yourself?
Yes, sir. Yes, doctor.
Okay. So you would need to tell your husband, and also I think if it's okay, I'll have a social worker. You haven't done what's called a medical power of attorney. Have you an advance directive? I didn't see one in your chart.
I have not, Dr. Moss.
Okay, so I will have a social worker call you and arrange to do a medical power of attorney with you. And then there's also another document called a living will. And a living will says that if you no longer can make decisions for yourself and you're dying, you wouldn't want to be kept alive on machines or with life-prolonging interventions. I'm assuming that you would agree with a living will.
I would agree.
All right, so I will ask the social worker to talk to you about doing both a living will and a power of attorney. And if your husband were not available, the medical power of attorney form has a second person you could name as a backup, just in case. Do you know who that might be?
That would be my son.
Okay, and what's his name?
His name is Robert also.
Robert also. Okay, so, all right, I will tell the social worker then to contact you and arrange to get those advanced directives completed. I will fill out this POLST form and mail it to you, and if you can sign it and then mail it back, then we will get a copy in your chart and a copy for you to put on the refrigerator at home and a copy in our statewide registry, if that's okay.
Now, does that form have to be notarized, Dr. Moss?
So the advanced directive needs to be notarized, but the POLST form does
not.
And
okay.
The worker will work out the details of getting it notarized, witnessed and notarized, the advanced directive.
Okay.
All right. So we've sort of really covered a lot of territory. What questions do you have?
I think I asked you before that, will someone be able to also meet with myself and my family to help my family understand? Yes.
And I would be happy to do that. And I'm going to ask the social worker when she talks to you to try and figure out when a good time for that to be. And it might be best, honestly, for me to do a home visit and to plan a time when your family can be there and we could go through what's going on, with what your wishes are. Have you told your husband that you don't want to be on a breathing machine again?
I have.
Okay.
We've talked. Now, can I ask you, will my other doctors be notified?
Yes, and so I will send a letter to to Dr. Gonzalez, and when you say other doctors, who else are you thinking of?
My cardiologist, my pulmonologist.
Yes.
Those are the two I can think of right now.
And your family physician too,
right.
I would guess. Okay, yes. And your family physician's name is?
Dr. Isbell.
Okay, all right. So I will send a letter to him with a summary of our conversation today, the fact that you're completing a POLST form, a medical power of attorney, and a living will.
Okay.
What other questions do you have?
I think I'll have more questions once after the family. I meet with the family and my husband, and I'm sure I'll have more questions then. Okay.
All right. So at this point, then, I think we've really made a plan. We're going to do some follow-up. I'm going to meet with your family. The social worker is going to do an advance directive with you. I'm going to mail you the POLST form for you to sign.
Okay.
Then I'm thinking that it might be a good idea for me to plan to meet with you in a month, just to sort of see how you're doing, follow up on things, see if we need to make any adjustments to your treatments for pain and symptom management, to make sure that, we really have your goals for your treatment firmly established. Does that sound all right?
Oh, that sounds good. And then you'll notify my cardiologist, because I have an appointment with him in about a month. So
yes, I will. Okay, I will. And depending upon what's going on with with this pandemic right now, either we'll meet in person or we'll meet by telehealth again.
That's fine, Dr. Moss.
All right. Well, Darlene, thank you very much for taking the time to talk to me today, and I will be in touch.
Thank you. This is one appointment I knew I shouldn't miss.
Okay, well, thank you.